You're all still watching Gist Nigeria from the BBC and Channels Television. I am Uwali Fakile. Coming up, the engineer advocating for cybersecurity awareness in Nigeria. But before then, only a few African countries have the regulations and health facilities that would make it possible for organ transplants to be carried out within their borders. Patients across the continent incur huge costs to fly themselves and their donors abroad to have transplants done. Now, Uganda has passed a law that would mean that transplantations can be done at home. Now, what does this mean for patients needing help? Patients at Wairi reports.
This is the only public dialysis unit in the country. It operates 2 different shifts every clinic day, and each of them takes in about 30 patients.
Many of the patients who attend this clinic should be having at least 3 dialysis sessions per week, but some cannot afford the transport costs involved and are therefore able to do only once or twice a week.
Nephrologist Dr. Daniel Chigundu is the only specialist available for the entire unit.
We have close to 190 patients attending the service. And that means we are running very close to capacity. We have little spare room for scheduling.
28-year-old Anita Twanjirwe is a patient there and has been living on dialysis for 3 years. She dropped out of university and lost her job. Ms. Twanjirwe raises about $100 through friends and family every week for dialysis and medication. She says that living with kidney disease has taken over her life.
Now, having been a burden to people who help me pay dialysis every time. Whenever somebody sees your call, knows you want money from them since I'm not working. So it took out all the dreams I had.
An organ transplant would give Ms. Twanjirwe a new lease of life. But currently, there are no laws or health facilities that would make it possible for this to be done in Uganda. A trip abroad for her and an organ donor would cost at least $30,000. The new legislation gives her renewed hope. To prevent organ trafficking, a patient's medical records are reviewed by a government committee before one is cleared for travel. The new law will allow the establishment of organ banks where those who wish to can donate. It will also make it possible for more than 100 Ugandan surgeons already trained to carry out transplants to practice. Many of the patients at this clinic live every day with the next dialysis session on their minds. For them and many others, having legislation and health facilities that make organ transplants possible here in Uganda would be a lifeline.